Thank you for giving me this opportunity to attend the European Cholangiocarcinoma conference. I really appreciate the chance to share my work about USP22 in cholangiocarcinoma progression. Cholangiocarcinoma is the second most common type of primary liver cancer. The overall incidence of CCA has increased over the past few decades. However, the survival rate remains not increased during this time. Most patients have lost the opportunity for complete resection, which is deemed to be the most effective treatment. Moreover, recurrence is found in about 70% of patients undergoing curative resection. Meanwhile, extrahepatic metastases are seen in almost 40% of cases. Deubiquitination is one of the main post-translational modification mechanisms by which regulating protein activation, DNA repair, gene regulation, and signal transduction. This process is initiated by enzymes such as E1, E2, and E3 to modify the target proteins. Opposing these enzyme activities, deubiquitination by deubiquitinase removes ubiquitin from the proteins to maintain physiological homeostasis. USP22 is one of the subtypes of ubiquitinase. In 2012, our team collected tumor T cells from liver cancer and cells for proteomics analysis and found USP22 was increased in tumor T cells and cells. Further study also confirmed that USP22 is involved in the invasion metastasis, drug resistance, and is negatively correlated with clinical prognosis of HCC. However, it is unknown about USP22 in the cholangiocarcinoma progression. We collected 27 paired CCA and adjacent normal T cells and analyzed their USP22 mRNA expression and showed that it was widely elevated across all tumor T cells, particularly those with invasive lesions. It was also detected by immunohistochemical, showing that it was consistently upregulated in CCA, present predominantly in tumor cell nucleus. Importantly, those patients with high levels of USP22 had a worse overall survival, believing that USP22 may be a poor prognostic marker to predict CCA progression. By comparing 36 non-paired CCA with the non-tumor T cells, we show that USP22 was upregulated in CCA, but had no significant correlation with copy number of USP22 with their deletion, deployed, or amplification. To explore the function of USP22 in CCA progression, we established USP22 stable overexpression cells in HCC and whose 28 and knocked down USP22 in cells of RBE and QBC939. USP22 overexpression increased cell proliferation and colony formation, while silencing USP22 decreased cell proliferation and cloniogenesis. Furthermore, compared to their controls, migration and the invasion of cells with USP22 overexpression were respectively increased, and the silencing USP22 reduced the CCs CCA cells mobility. Immunofluorescence staining revealed that USP22 overexpression downregulates the cellular membrane localized E-cadherin and upregulated vimentin. The similar results were reproduced by Western blot and flow cytometry. And we got the opposite results when the USP22 was knocked down. These results show that USP22 promotes CCA progression and induced EMT in vitro. We then simultaneously injected cell lines of USP22 overexpressing or silenced and the control cells into the nude mice. The tumor size and weights of USP22 highly expressed group were increased. However, silencing USP22 made the tumor size and the weights only half of the controls. After a 6-week period of injection of CCA cells into the tail veins of the mice, we harvested lungs and stained the tissue sections with HE staining. The total number of metastatic foci in USP overexpressing group were twice to the controls. The opposite was true as the metastatic foci of USP22 silenced group were only 1/3 of its control. These results corroborate with the in vitro findings, indicating that constitutively active USP22 confers a more aggressive phenotype to CCA in vivo. As a component of SAGA, USP22 deubiquitinase is to be to regulate transcriptional activity. It is also reported that USP22 could stabilize SOT1 for maintaining physiological metabolic homeostasis. By immunoprotein analysis, we showed that USP22 upregulates SOT1 with increased ERK and AKT phosphorylation. The opposite results were observed when the USP22 was knocked down, suggesting a responsive SOT1 expression to USP22 in CCA. Knocking down USP22 increased a fraction of SOT1 relatively to the control cells. Treat them with MG132, a proteasome inhibitor, retain the levels of SOT1 in USP22 silenced cells, while incubate USP22 silent cells with cycloheximide to block protein translation. We show that silencing USP22 downregulates the SOT1 protein in a time independent fashion. At the same time, the levels of SOT1 expression remained constant in the control, suggesting USP22 is prerequisite for the SOT1 stabilization in CCA. To determine the physical interaction between SOT1 and the USP22, we performed the co-IP endogenously. We also confirmed their interaction by transfecting flag-tagged SOT1 or MAC-tagged USP22 alone or co-transfecting them into 293 T cells. And the results reinforcing the presence of the complex formation of SOT1 and the USP22. To investigate if SOT1 degradation was ubiquitination dependent, when USP22 was absent. We repeat an IP for endogenous SOT1 from USP22 silenced all the control cell lysis with the SOT1 antibody, and the immunoblotting with antibody for ubiquitin. The ubiquitinated SOT1 was accumulated in the USP22 knockdown cells, but not in the controls after the normalization with SOT1 in IP, showing the ubiquitination mediated SOT1 degradation. Furthermore, we elevated the effect of SOT1 on oncoprotein TAK1 and AKT acetylation. We showed that the acylated TAK1 or AKT were upregulated when SOT1 knockdown. The similar results were also achieved by silencing USP22. While overexpressing USP22 downregulated acetylation of TAK1 or AKT. We show that USP22 and SOT1 are part of protein complex, and USP22 regulates SOT1 deubiquitination. Furthermore, SOT1 modified TAK1 and AKT epigenetically, involving deacetylation. To determine the functional interface with USP22 and SOT1, we overexpressed the SOT1 in USP22 silenced cells. The ectopic SOT1 overexpression restored capabilities of USP22 silenced cells, proliferation, migration, and emission, in conjunction with increased anti-apoptosis in vitro. By immunoblotting analysis, in comparison with the silencing USP22 alone, SOT1 phosphorylated ERK and AKT and decreased pro-apoptotic effects with spontaneously increased anti-apoptotic BCL2. Furthermore, SOT1 upregulated vimentin and downregulated ecadherin when USP22 silenced. Thus, our results suggest that SOT1 takes part in regulating CCA survival and USP22 induced EMT. To summarize, both the mRNA and the protein were significantly upregulated in CCA, correlated with the invention and worse overall survival. USP22 increased the CCA cell proliferation, mobility, and EMT. Conversely, knockdown USP22 attenuated the tumor growth and the invasiveness. Upon interaction, USP22 deubiquitinated and stabilized SOT1 in conjunction with ERK and AKT activation. And the fourth, SOT1 overexpression reversed the USP22 function deficiency, while the knockdown accelerated TAK1 and AKT. And the last, our present study defined USP22 as a poor prognostic predictor in ICCA that cooperates with SOT1 and facilitates tumor development. Finally, I want to thank my director, Professor Li Mingwang, as well as Professor Shijie Cai and Tang Bo. Also, my teammates such as Dr. Ye Mingliang, Gao Zhenming, Liang Rui, Wang Chengye, Wang Yan, and Wang Jiakai. Thanks for your attention.